And now let's further discuss this, and I'm pleased to be joined by Hu Naijun, Associate Professor from the School of Public Policy and Management at the University of Chinese Academy of Sciences. Well, Professor Hu, great to have you with us on the show. As we've just heard, they're having confirmed cases with longer latency than before. Does this equate to higher risk of infection?
I beg a little pardon? I didn't hear the question very clearly.
Well, we've seen cases that people are exhibiting symptoms or testing positive after the latency period, 2 weeks latency period. So does that mean that we are seeing higher risks of infections?
Yes, I have noticed that there are some kind of variations of the time interval of the virus. As we all know, some people, it is confirmed also by authoritative resources that some people may have a very long quarantine time, for example, longer than 14 days, and after that it could be tested positive. And also, some people may have 11 times of expectations and test test then can prove to be positive. But in my opinion, all these are very special individual samples, because as we all know, any kind of infection interval or average numbers can be dictated through through statistics. That is to say, if we have the total population's result, we have to make a sample, and the sample could be representative of the total population. But if the statistics takes too long a sample, it will cost a lot of money and time. So I think we must rely on science and statistics. That is to say, for the majority of the samples, we should say that the current policy is relatively acceptable. For example, the 14 days quarantine or the nucleic acid test, etc., etc. We cannot change our whole policy only on the basis of one single sample.
And Professor, more and more countries have started launching vaccination programs, and the WHO says that antibodies are expected to last at least 6 months. How does this help with prevention in the long run?
Yes, I think it is a hot topic right now about how long will the antibody last. In my opinion, I think we must rely on science and data and reality. That is to say, as we all know, that the vaccines research has only been started less than half a year. So we cannot say how long exactly the antibody will last, because we only have about half a year's time of research. That is to say, if some people say that our antibody can last more than 6 months, it is ungrounded. That is to say, there's no reality to prove that. So I think as to how long will the antibody last, in my opinion, we still have to rely on science and on the current research. But we still have to wait to see how long will it last, because only the reality can prove any kind of dissertations.
Right, only time will tell. Thank you so much for your analysis, Professor Hu Naijun.